Hey everyone, welcome back to my YouTube channel. Today is probably one of the most awaited videos. What do I have done and who do I go to? You've all seen me tag Dr Esho on Instagram. He is a friend and a colleague and actually my biggest and most incredible mentor. I've learned a lot of things from in the industry from Dr Esho, and he's the only person that I trust with my face. I have been going to Skin Lab, which is the skincare program at the Esho Clinic, for 3 or 4 years now, and actually I'm wearing no makeup at the moment, so hopefully that gives you an idea of how my skin looks at the tender age of 35. And I'm going to see Dr Esho today, who is very honest with me, is very minimal, and does preventative work on my face. So come in, join the journey, and have a look at the exclusive scenes of Dr In's face, which apparently interests you because I get so many questions about it. Favorite human being? How's it going? Yeah? Amazing. T, so good to see you. So basically, I just wanted to talk to you about a few things. Obviously, I love it because you always nip me in the bud and you're like, don't do too much to your face. But basically, I was thinking it's been a while since we had the Botox done. Okay. What I really don't like is this eyebrow, I feel lifts higher than this one. Yeah. So I don't know if it's like an anti-spot injection or something like that. And also here, I know it's not a lot, but I just prefer it to be like more of that smooth forehead look. Okay. So I don't know if we can achieve that today. It'd be great, especially with this eye, because I feel it raises higher. I don't know why that is.
You typically have something called a Mephisto, where you have one brow stronger than the other. And that's really common, you know, most people do have it, we just don't notice it because everybody's asymmetrical. Now the only thing for you is depending on which brow you like the best is what we approach to do. So do you like the lower one? Yeah. That's perfect. Okay, great. Because actually someone likes the higher brow, it's actually harder to raise it up to that position. But it's easier to, as you said, anti-spot, do a few more injections just to lower that one and also keep that in proportion. We can do that today and also inject just around the brow area to give you that smooth, more taut look, but it still look natural at the same time. And then for you, from a skin point of view, it's really good. We want to just boost that hydration, particularly this time of year, so I think Profhilo will be really good as a skin booster for you today.
How are you feeling about the aging around my face and under my eyes? Because obviously I had a bit of a situation where, you know, you dissolved it, and I'm actually a lot happier. I've actually had more compliments about my face recently, because people are like, you're looking really young, which was weird, because I'm like, oh, the filler's all been dissolved, you know? So do you feel like Botox and Profhilo is the only thing that we need to
I think so, you know what I mean? It's always about a less is more approach, you know, I want to think about managing you now in the long term. So for me, it's about structure, but then also doing little bits at a time. I think when we do your under eye area rather than fillers, which you had in the past, I think PRP, which is platelet-rich plasma, that rejuvenate the area and boosting hydration as well as the volume would be the right way to go for you. But I think today, less is more, small amount of Botox, balance the brow, make the area tighter, hydrate the skin, and then we'll see you back in a few weeks' time.
Amazing. I love it. Thank you so much. Let's get started.
Good. Let's hop into the chair. I have the fabulous Dr. Rona in my chair today, and she's going to have a combination of my patented Botox procedure as well as a combination with Profhilo, which is one of my favorite skin boosters. Skin boosters, there's many on the market. You've got Wrestling, they have skin boosters. You've got Balatero, Revive, you've got Profhilo, you've got Allergan, which is Jubilant, they've got Bolide. So there's different skin boosters along the whole market. They probably talk about the most recent one that's been released is Balatero Revive.
That's the one,
Which you've got, and then also Lanuma from Sinclair.
Would you try it?
It's okay. Out of all the kind of skin boosters, to be fair, I still think Profhilo is the best one.
So you describe Profhilo as a skin booster more than anything?
Yeah, it is. I think people mix it up because they think it's a filler because it's hyaluronic acid. No, and the big difference between a kind of skin booster and hyaluronic acid is that the hyaluronic acid isn't cross-linked, which means it doesn't have bonds to make it rigid. In Profhilo, you've got high molecular weight hyaluronic acid, low molecular weight hyaluronic acid, and they're just floating about in this complex matrix, which when you inject into the skin in specific points called back points, it stimulates collagenesis and the skin gets hydrated. as well as the same time boosting your own collagen. In filler wise, it's different. So you've got the high molecular hyaluronic acid, and it's bound to each other with these bonds, and you've got something called PDE in there, which again helps the cross-linking, so it's much related. So it almost acts like an injectable implant rather than a skin booster, which is something that gets completely absorbed or stimulates the skin.
Okay, makes sense.
Yeah, there's so many things that can be done together. You know, I like to kind of play with loads of things within my clinic. The beauty of Profhilo is it's a skin booster, and when you're treating the skin, you can treat it with multiple modalities. You know, it's like a PT. You go to PT, they're not going to give you one exercise to do repeatedly. So it's the same with skin. You should figure out different ways to challenge the skin and boost the skin at the same time. Many times you can do it in one sitting. So we're just going to inject this complex area here called the patella. We've got a muscle through here called the proscenus, and then we've got the two muscles each side of here called the corrugator muscles, which lead underneath the brow. When she frowns, these muscles pull together and cause lines within this area, or your 11 scissors, you normally know those. When you inject these, because they're normal depressors of the actual area, while the frontalis, this muscle across here, is an elevator, what you do get is a nice initial raise because these muscles recruit and bring those over. How's that?
Fine.
Beauty of it as well, depends what needles you use. So we use these really kind of microfine needles. They're so like hair-like, I can actually push that and bend it. Relax.
I feel like I'm going to sneeze.
I know.
A really random question, right? People with Bell's palsy, can you treat them with Botox
So,
to help?
not really.
No.
The reason why, because of that, is because essentially the Bell's palsy is a weakening of that nerve when you practice. So that side of the face is weaker. So what you're gonna do then is you're gonna weaken the normal side, and actually then the person's face is gonna look like asymmetry, which would be worse. So really what you wanna do is you wanna try and give innervation to the weakened side. And usually sometimes they involve surgery where they kind of use innervations of the contralateral nerve on the other side to try and improve the outcome. You can inject these small bits here. Not a lot of people do that. I tend to like to do it. I think when they do that, it tends to elevate the actual sale. And that's really important, particularly in females, because when you're doing Botox, if you don't do that, the brow can become flat and more masculine. So you really want to kind of maintain that arch.
Are you treating the frontalis today or no?
Yeah, because we need to balance that.
And also I get headaches and migraines, but I found this does help. Why?
So Botox and migraines is a funny thing. So it is a treatment for migraines, and if you're diagnosed with migraines, you can generally get on an NHS, so I do recommend people to see their doctors about that. But there's different types of headaches, you know, from tension headaches to cluster headaches to migraines themselves. Botox really has an indication more in tension headaches because of relaxation of the muscle, and then also in migraines, but relaxation of the muscle, but then also as well how it affects the blood flow in that particular area. Migraine Botox is really more about specific injections in different areas of the forehead, whereas tension and Botox is injection in the area where there's tension. But people tend to find relief. Funny enough though, some people who don't have headaches, 10% of people can have a headache post-Botox. And that's usually due to how the muscles relax around the area too. Right, so raise up for me, once you can. So that's where you peak.
Yeah, can you see it?
So we put a tiny baby drop. Raise up for me. Then what we don't want to do is do the same on that side, because if we end up doing the same problem, then that's going to be lower. We don't want that, so I'm going to keep a little bit less. You know, so I only did one there, didn't do another, because it's already lower the position where I did two, just on there, just so it will balance out.
Thank you.
Perfect. Right. And then Profhilo. Let's do
a bit annoyed because I'm getting redness in my nose. And I really want laser, but I can't be out in the sun.
This is what I was about to say. You always go on a holiday. You can't be in there. Laser tends to be a wintertime treatment for many people.
But I still go out.
And you can hide. This is it. This is the problem. You need to be away at least 2 weeks post. So now we're going to be doing Profhilo now to help boost the skin hydration and at the same time help a little bit with volume. We tend to inject on 5 areas on each side of the face. These are 5 specific areas called BAT points, which means bioactive points. And you will see it's one of the things in aesthetics where you have to make lumps. The other times everything's smooth, but what we do is we make these lumps because the injection is superficial, so you tend to hear a little crackling and a pop. Those lumps don't stay there, they dissolve into the skin usually between 3 or 4 hours, and then they start to get to work across the whole face. Blood, love it. Love a bit of blood.
Mentalis one I can't stand. You're very gentle, very.
I know, I've got massive hands, but they're like pixies. Perfect. Right, one side done, next side to go. Good. How you feeling?
Fantastic.
Perfect. So today in my clinic, we've got the lovely Dr. Rona, and what we did for her was my fabulous Botox treatment. It's not the normal Botox treatment. It gives you that natural lip, but then also looking natural at the same time. I also did the skin booster with Profhilo, we injected her at 5 BAT points. She's gonna be looking hydrated, snatched, but natural at the same time.
Thank you so much, guys, for coming in and tuning in today with me at the Esho Clinic. As I said, this has probably been the most asked for thing on my social media accounts. So you get to meet the incredible Dr. Esho. He is the only person that I trust with my face. So much.
Thanks, lovely.
Listen, once things have calmed down, let's try and grab a catch-up dinner.
We will.